Welcome back to Urgent Care Unscripted. My name is Barbara Renalter. I'm the Director of Operations and Business Development for AFC Urgent Care West Haven.
And this is Muhammad Zaman. I'm the franchisee and owner of the Urgent Care in West Haven, AFC Urgent Care in West Haven. We are here to talk about an interesting topic. Building your own healthcare team is something that you don't maybe think about it all the time until you're in a situation. Who is your team that cares and supports and diagnoses and treats you at the moment you need it?
Yeah, I think we get this question a lot. Most people think about their healthcare team. They really just think about their primary care provider. But obviously, a healthcare team is a lot bigger than that. And today we're going to welcome Felix Pacheco, our medical director and also a veteran ER physician.
Veteran makes me sound so old.
He is old. You are a little old.
A few grays here and there. Thank you for having me. Always great to be here.
And I really have enjoyed and very proud to have worked with Dr. Pacheco for quite a while now, because he has helped us give us shape and structure and discipline and the foresight for how to build this clinic and build a team here. And so I am really fortunate to have him here to join us talk about a patient's healthcare team perspective.
I felt like a plastic surgeon in that description. Shaping and molding.
I was going to say, don't let your head get too big there, please. So let's start with the basics. When we say healthcare team, what are we really talking about?
So if you think about every patient individual and the people surrounded, ensuring that they're healthy.
Yeah.
But more and more what we are seeing is that it's not just a place for a quick fix or a place where you come only when you're sick. I mean, more and more patients want to stay in touch with us, to build a relationship with us before anything unexpected happens, and that helps them to get going with their life faster than they could have if they didn't have the relationship.
Definitely. And I think it touches on a couple of things. Modern day needs and timing of society, jobs and family and everything else that goes on. Your individual needs and the timing of those needs had to fit. And primary care is often thought of as the healthcare home of an individual, right? But then sometimes you are away from home, can't get into the home, it takes too long to get into the home. Think about all those reasons. Then you have to think of, okay, well, how can I satisfy these needs that, maybe on the urgent end where you want to be seen soon because you have an illness, you don't feel well.
Or it could be the weekend, So.
Yeah, or they're not open, or, it's busy. It's they don't have space because other people are sick as well. Think about like flu season, how everyone's sick, and primary care providers will be busy then. I mean, everyone's busy then, but you want to have a team because of the needs that need to be addressed can vary, and if you can't be seen by your primary care doctor, then you have someone else that you can see.
Absolutely. I think from an operational standpoint, I can definitely see a clear difference when patients come to us and connect, not only come to see us like on a regular basis, not jumping from place to place, but also connects us with their primary care providers and their cardiologists and whatever other specialties they might be seeking, because we are able to build a better assessment for the patient, knowing all that information, and also communicate with the partners that we have. I would consider primary care providers our partners. Same thing with specialists. So I think it's very important that you have a home in primary, but also have a home in urgent care as well.
Yeah, and it's not like we are replacing primary care,
No, yeah.
But at the same time, we come with the X-ray machine, we come with the EKG machine, we come with all kinds of tests that we can at least initiate at the clinic that you might not find so easily accessible somewhere else unless you go to an emergency. But at the same time, we are really not replacing PCP, we're actually partnering with the PCP, with your PCP, to share the information, to send the information to them, or get the information from them to give you the best treatment you need at the moment when they might not be as much accessible or may not be as much, equipped to handle that particular need.
Yeah, definitely. And I think Barbara touched on a point that the establishment of a relationship, to some degree, like in the emergency department, you're unlikely to have any relationship with any provider there, right? But in the urgent care setting, we're probably going to be close to where you live, or work. And something that when you can't see your doctor, then you may have just a few providers that you have become accustomed to, and they get to know you, and that changes things. It changes the dynamics as well.
Absolutely. And then I think one other thing that we see a lot is patients don't come to us and they don't have a primary care provider. So that relationship goes both ways, where we create a relationship with the patient and we can also then guide them towards a primary care provider that we believe would be the best fit for them if they haven't been able to find that on their own yet.
And this has eventually, there are many situations where of the 10,000 plus visits that we have seen in last just 1 year, many of them are from patients that are coming to us 5 times, 10 times, 20 times in just 1 year, because they have built that relationship, they trust us, they have come to like the providers, and sometimes ask for the same provider, that can I come and see that particular provider. That's so refreshing and comforting to know that they are building that relationship and getting the cure they need, and on time too.
Definitely. I don't have much to add to that.
No, I think that's great. It's a great example there too. And then there's also been situations where we've caught things like for the first time, right? Patients come to us regularly and we end up saying, hey, this is the third time you've been here, and I noticed that your blood pressure is consistently high. So we might need to kind of address that at some point. So those are things I think even from like a provider perspective, you can kind of see that trend, and that's easier. It makes it easier for you to identify those conditions. So
yeah, they're definitely like I could definitely think of young males being the category of not having a primary care doctor, right? Because who thinks they're gonna get hurt or sick when they're like 20 something years old? And then one day they're 50 something or 60 something and they still haven't seen a doctor. And then you have these visits where you haven't checked in on with anyone. And things can get noticed, I mean, ideally you'd have a healthcare home, but we can definitely try to pick things up and hopefully prevent them before it becomes something truly problematic.
So if we're thinking about having a healthcare team, what would be the steps towards that? What can a patient do? Okay, if I do this, then I have a healthcare team. Perhaps the first step is to have a PCP really assigned for yourself, and then what?
And then I would say find an urgent care, because that's probably going to be your second home, I would say.
Yeah, and if you're a woman, you should probably get OBGYN also.
Of course, yes.
But in general, it depends on what your individual needs are, your age, your risk factors. But having a primary care home as well as an urgent care that you could consider a second home or an apartment.
There you go. Your city apartment.
Hey, come here for the fun.
Yeah.
So have a PCP identified, have an OBGYN identified. If you have kids, perhaps also have a long-term basis pediatrician to work with.
Definitely.
And then come to us for any urgent care needs, or even advice and consult. Can we treat it, or can we then send you back to your PCP or pediatrician, or maybe an emergency room situation? But having that relationship established with these couple of entities will keep you covered from your healthcare need perspective.
Yeah. And, sometimes we don't speak about the mental health needs as well, but, there are therapists that are probably needed for providers and patients alike.
Definitely for providers.
Definitely.
All right. So next time you need an urgent care or you need an urgent care home, definitely look for something that's conveniently located to you and has good hours. Obviously, we are always available for our West Haven community or surrounding areas. We are at 354 Sawmill Road in West Haven. And thank you so much for listening today.
And thank you for listening to us. So your healthcare team that we covered the topic today does not have to be complicated, but as long as they are connected and as long as you have a definition around it and those relationships, you are way to go in taking good care of your and your family's health. We appreciate everybody joining and listening, and thanks Barbara and Felix for your advice and kind words, and looking forward to the next episode.
The right care when you need it.
Yep. Thank you.